It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hello everyone, I'm Grace Sells and welcome back for another edition of Best Docs Network, the show that's featuring some of the best doctors in the Houston area that are really changing people's lives. Up first on our show, we're going to hear about valvular heart disease with interventional cardiologist Dr. Annie Varughese.
As you get older, sometimes you have trouble finding words. So my daughter got all worried, so she'd maybe go to a neurologist. So he does his thing, go back later, he said, it looks like you had a couple small strokes. They're small, they're not gonna bother you. But, he says, you need to go to a cardiologist to check out your heart, just to be on the safe side.
Valvular heart disease encompasses many different entities. The heart has 4 different valves, and Gary Singerman had actually infection and rupture of his mitral valve, which is a very important valve separating the top and bottom chamber of the left side of the heart.
So she sent me to Houston Northwest Hospital, where she had them ordered ultrasound for me. I feel fine. Can I go home now? So my wife and I are sitting there, and she comes in with this film of the ultrasound. She says, could you see the mitral valve there? I said, no, I'm not trained for that. So she points with it to her pen and says, right there, it's hanging down in the ventricle. It's been ruined with the bacteria, and it's not doing anything. And so she says, within a month, you're gonna have a massive heart failure. And I heard my wife gasp, and I got rocked. Wait a minute, I feel fine. She said, I'm checking you into the hospital right now.
Mr. Singerman had mitral valve prolapse, therefore the valve was not closing properly, was redundant and thick, and therefore it was easy for bacteria to stick to that valve and cause infection. And this happened before I met him, and his story is quite interesting, how he came to me. He immediately needed surgery because his valve was infected and ruptured and not working at all. But he's very thankful that he came because we were able to save him.
Obviously, I lived, but the point is I may not have if Dr. Varughese hadn't caught that ruined mitral valve, and so I owe her.
Start sprinkling your oatmeal with some cinnamon. Studies show that this antioxidant-rich spice may reduce blood pressure and lower stress.
Mr. Weber, he basically came in with typical symptoms of plantar fasciitis. It hurts in the morning, or, I can't play golf because I'm just always in pain. And
plantar fasciitis, as anyone who's ever had it, it's pretty painful, very, very painful, especially getting up in the morning. And
plantar fasciitis is a pain that honestly, in my practice, I probably see 10 to 15 times a day. So typically, someone complains about that first step in the morning when they get down. When you bear weight, okay, your arch actually collapses and your foot gets longer, and this ligament-like structure that's on the bottom of the heel pulls from the heel bone. So when it pulls from the heel bone, you get inflammation. Inflammation triggers the pain cycle. So essentially, every time that you're bearing weight, you're restarting the pain cycle, and it's chronically inflamed tissue on the bottom of the heel.
Well, I have to say that this procedure is really amazing. After the recovery time from the surgery, it really is immediate relief. Immediate.
The Tenex procedure is basically, it's an ultrasonic device that allows you to debride the scar tissue. So when you have plantar fasciitis or any kind of inflammation of a tendon, you develop scar tissue. And so using ultrasound for guidance and using like a micro tip, you're able to debride the scar tissue, remove it, and basically start the healing process. The key feature about it is that it's a single incision, one suture, and the patient can weight bear immediately after. So it's cutting edge technology combined with minimal incision surgery.
It's really remarkable. I mean, it's truly remarkable. I don't have any pain in the area that it affected me. It was really, truly amazing.
It's a 15-minute procedure. It's very precise because you're using an ultrasound machine for guidance, so you can actually visualize the plantar fascia. And it's minimal incision, literally just one suture on the inside of the heel. So it's not on a weight-bearing part, so you can immediately weight bear after the surgery. Patients love it, and so I love having this as a new thing I can introduce to my practice.
Did you know you can request an appointment on our website with any of the amazing physicians that you've seen on our show today? Just go to bestdocsnetwork.com, head to the doctor's profile page, and click on the Request an Appointment tab. And you can even request an appointment with our next physician who helped change Sam's life. It's vein specialist, Dr. Peter Morgan.
A few years back, I started having ulcers show up on my lower ankles. So these ulcers would take 2 to 8 months to get rid of. Once those would heal over, another one would pop up.
We did an ultrasound and discovered that he had severe chronic venous insufficiency with very large varicose veins and swelling. His biggest issues were that he had open, non-healing wounds. He had a very large one on the right side, and he had a much smaller one on the left side. He'd been seen and treated by a variety of people with a variety of methods over the years. None of them had worked.
They said, well, that's not really a problem. We have surgeries that we can do on an outpatient basis. We can get rid of that for you in no time.
We very carefully mapped out which veins were bad in his legs, the ones that are running backwards, and then made sure we understood where the blood was running correctly, and we ablated selectively the bad veins to restore the venous circulation out of his legs back to normal. And that improves the overall health of the leg and improves healing, and he actually healed up very nicely.
The procedures, like I said, didn't take any time at all. Come in the morning, go to work in the afternoon, not a problem. There was no pain after the surgeries. All went well, went back to work, no problem.
You can have wounds that are unrelated to venous insufficiency, but most chronic non-healing wounds are related to problems with your veins. But if you have a non-healing wound, that is almost certainly from venous insufficiency, and we can heal virtually all of those wounds here with the procedures we do.
Having the circulation back in my lower legs allows me to work longer. It allows me to stay on my feet longer. I don't have the foot pain that I had prior. The procedures helped dramatically.
Dehydration affects digestion, energy level, and fitness. An easy way to make sure you are drinking enough water is to make sure your urine is the color of pale lemonade.
A lot of people take herbs and supplements. Some people says it makes them feel better, but it's really not scientifically proven. From a scientifically proven situation, herbs and supplements just don't do that much good. Now, they do help some people feel better. That may be placebo effect. It's hard to know. It also may be something we just scientifically don't know yet. So if it makes you feel better, well, by all means, take it. It's not going to hurt you unless you're doing mega doses. It's better to get, from a scientific standpoint, your herbs and supplements in your foods and fruits and vegetables. Anything green, yellow, red, or orange is going to be good for you and have good herbs and supplements in it. Now, the kinds of things that are bad for you, and they have been proven to be bad, for example, is milk thistle. That's a no. Bitter orange, that's a no. Ginkgo biloba that people use to help their mental function, that's not going to hurt you, but it just won't work. And especially stay away from those expensive brand name stuff. They just go right through your system, and all you're treating is the sewage system.
I found out about James through a local chiropractor who has treated a lot of wounded warriors and has worked with them and donated his time to help those guys.
On February 26, 2006, we were on a presence patrol, and we got some information that they were making IEDs in a mosque, which is a place that is the majority of the time a place where we can't go mosque in schools. But anyway, we went there, we followed the information, detained some personnel, and as we were leaving, there was an SV bit on site that detonated right next to my striker. A piece of shrapnel entered through my helmet over my left ear and gave me a skull fracture, a windshield skull fracture.
He was in Walter Reed for a long time, coma, trauma, and he's made a remarkable recovery. He's self-conscious about his teeth. And it's not that they were broken up or damaged in the accident that he had, but he's studying to be a nurse practitioner. And so he's seeing people in the clinic. And so then he's going in and talking to patients and people.
I have a very stern and aggressive approach, and it's just ingrained in me after 10 years of being a ranger. That's just how you communicate. I'm learning to smile. And then I realized, growing up I was embarrassed about my smile, and when I see my patients and I don't smile, it's hard for them to, this guy is too serious for me to be treating me. He's mean.
He just had a self-consciousness about his teeth, and yes, they definitely could use veneers. He has some teeth that are real crooked and tucked in and stuff, so he's a perfect candidate.
The whole team here, they've taken me in, and I'm excited about the change because I know my demeanor is going to change as I work with my patients.
I have so much respect for these guys who go and put it on the line for our country. And my dad was wounded in the South Pacific in World War II, and I'm just a big supporter of our veterans and what they do. So I wanted to help this guy. I just wanted to, and I think he's going to get a fantastic result.
For more information and to check out hundreds of videos, head to our website. It's bestdocsnetwork.com. Now up next, we're going to see how rhinoplasty helped change Holly's life with plastic surgeon, Dr. David Altamira.
I had kind of a bump up here on the bridge, and the end kind of hung down a little bit. It was a little bit big. And I think a couple times in my life, guys had made comments like, oh, our kids would have really big noses.
Well, Holly came in with just the thought that had bothered her for a long time, that her nose just didn't match her face. She's an otherwise very attractive young lady, but she'd always had just a large nose that was out of proportion to the rest of her face.
I mean, overall, Dr. Altamira made the experience so easy and simple, and I think out of all the doctors that I spoke with, he was the one who made me the most at ease with the process, and he said, you can always do more, but let's do something modest for now, and it's just overall really comfortable.
First, we talked to the patient at length. We asked them what they like about their nose and then what they don't like about their nose. There are certain things that we can change and certain things we don't want to change if they're happy with that. We'll take several photographs from different angles, and then we can project them on the computer screen for the patient, and we can actually morph the images to show the patient what they can possibly look like. And that way we can make sure we're on the same page as far as what the patient wants to look like and what can actually be accomplished in surgery, so that they do have realistic expectations, and we can kind of give them a good idea of what they'll actually will look like after the surgery.
The recovery time was really quick. Dr. Altamira had explained that it would hurt for a little bit. He even gave me painkillers, but I think I took 2 of them. It wasn't as painful nearly as I thought it would be. And I think I had some soreness if I would touch it for maybe a month after, but overall it didn't hurt.
Rhinoplasty is basically changing the shape of the nose. It can be done for a variety of reasons. Usually, a lot of times, just the patient has always felt their nose was too big for their face. They were never happy with their appearance. And so it's basically a great operation that can be used to reshape the person's nose to match their face better.
It was so exciting taking that Band-Aid off for the first time. Like, when you look at yourself in the mirror, you always notice an imperfection that maybe you don't like. And for the first time I looked and thought, oh, my nose is adorable.
Jack from Tomball has a question for Dr. Annie. How can airplane travel cause clots and death?
Long travel can cause venous flow to decrease, so therefore the flow in the legs can kind of pool and accumulate and not come back up to the heart. When that happens after patients are sitting for long periods on an airplane, clot can form because the blood becomes stagnant. To prevent that, we tell patients to walk the aisles of the plane, exercise the legs even while sitting, and try to stand up intermittently throughout the flight. This will protect the patient from having clot formation. What happens when the clot forms is when the patient finally leaves the airplane and gets to their destination, clot can move and go up to the lungs and cause sudden death from a pulmonary embolus. Very critical to know about clot formation, very critical to prevent it, and easy to prevent by just moving. Actually, sometimes wearing hose will help, and knowing the risk factors of flying can prevent a problem when you get to your destination.
Lethargy, just tired all the time, anxious, couldn't let my mind relax, paranoia, and the paranoia was the thing that was destroying me. I just doubted everything that was said to me. I didn't think I was being told the truth. I was looking for anything I could find to prove that something was wrong in my marriage. I was completely convinced that I was headed towards the end and trying to figure out my life.
Samantha came in with mood challenges. She had a lot of issues right before her cycle, about a week or two before it happened. She would definitely notice that her moods would change. She would have more irritability, more anxiety.
From the moment she told me she could help me, I think my mind already changed a little bit. Was I skeptical? Yes. But when I started taking the hormones, which is just progesterone, I honestly believe it was within like a week or two that everything started to change.
Around the mid-30s, or even after we've had 1 or 2 children, we certainly notice a decline in how we feel, and that starts the imbalance of how our hormones start to change. And so during that period of time, we get a phase called estrogen dominance. So if we're able to take that progesterone and rematch it to the estrogen, we are able to correct the heavy periods, the PMS symptoms, the bloating, the irritability, the anxiety.
Oh, it's been over a year that I've been better, and I will never go off of these hormones if I can help it. I know people think, is this a short-term fix? Once I get better, can I stop? And you know, I've been told that no, this is it. These hormones aren't going to come back naturally. You have to continue, and I'm okay with that. I'm perfectly okay with that.
So we can have women who literally can't leave their house. They're so anxious, they're so depressed, they have so many mood challenges. And with progesterone, we're able to completely correct that. Samantha, once she was treated, her whole life was completely different. She was able to function so much better, her family was much happier, and really that made a huge difference in her ability to continue to function as a normal human being. I mean, she's able to just go out there and do what she needs to do and not have to worry about these severe mood swings anymore.
For more information on some of the best doctors in the Houston area and to watch other life-changing stories, log on to bestdocsnetwork.com. Switching out that bag of chips with your sandwich to 3 ounces of unsalted pistachios will help raise your HDL cholesterol, which is the good kind. On our website, bestdocsnetwork.com, we have a map that can help you find the best doctor that's closest to you, which could be our next doctor, who we're going to see change Julie's life with the lap band procedure. It's bariatric surgeon, Dr. Robert Marvin.
I weighed 236 pounds. It was just time. I needed to do something to feel better, healthier. I needed to feel healthier. I needed more energy. I needed to do something. I had the lap band as opposed to the sleeve or gastric bypass because it was less invasive and it was really the right decision for me personally.
She's increased her exercise in response to having the control to lose the weight more easily, so there's a positive reinforcement there. If they do the right thing in terms of exercise, if they're consistent, then they see a bigger drop-off than they had seen before they had the surgery.
As time went on, I started dropping the weight, eating, slowly, liquids and then your soft foods, the way that you were told to do it. And things just started to work out for me. I started exercising more and eventually it just started falling off.
Right now she's running, she's trained for a half marathon. And those are great things in terms of the exercise side of taking care of the weight. When it comes to eating, it sounds like she's doing a fairly good job switching to things that are lower calorie, less animal fat, and lower glycemic index. But it sounds like something, occasionally she eats things that aren't ideal for her. But I think her exercise takes care of that, and that's why she's at ideal body weight right now.
Physically, to be able to not huff and puff going up and down a flight of stairs, mentally, to work, to educate yourself, I think it makes it easier to feel confident about yourself. It makes things that much easier. Before the surgery, I was 236 pounds, and 3 years later, I am down 85 pounds.
Unfortunately, with a lap band, it's difficult to tell sometimes ahead of time who's going to do well and who's not going to do well. And we have patients that do very well with it, and that's great. The problem is the predictability when it comes to the lap band. So she's an example of someone who's used it as a tool the way it's supposed to be used. Unfortunately, that isn't the case with everybody.
University General Hospital is a hospital like no other, with state-of-the-art medical treatments in an inviting environment that pampers patients and families and encourages relaxation and healing.
Yeah, I lost a couple, and the rest of them started getting loose, and it was something that took about 5 or 6 years to happen. It just suddenly came on, though.
Yeah, George, his teeth were in an end stage in that they were decayed, and he also had periodontal disease, bone loss around his teeth. His teeth were chronically infected. They had become loose. Also, there was a cosmetic problem with his teeth, and George is a very outgoing person and likes to smile and has a great smile, and so his smile just didn't suit his character, not to mention the health of his teeth. It was really driving him down.
I was kind of getting to the point where things that required real chewing, particularly in the back of my mouth, was getting more and more difficult.
With George, what we did was removed his teeth. Now in him, we focused on his lower jaw. And from a financial standpoint, many individuals decide to maybe focus in one jaw versus the other. Now granted, with him, we could have done both of them simultaneously, but for whatever reason, and oftentimes it's schedules, their busy work schedule, also finances, that they'll sometimes stagger the case to suit them better. And with George, we focused in his lower jaw and we removed all of his teeth, upper and lower, but we put the implants immediately in his lower jaw.
I'm feeling fine now. I'm back to the point of eating anything. There's no problem. We're continuing on. I'm not quite through with all the procedure, but just about.
And that is a misconception that we're seeing right now with the advertising, where it talks about get this all done and complete it in one day. Reality is the final is usually done later down the road once the body has fused to the implants, and the textbook answer for that is at least 3 months, but it can be as long as anywhere from 3 to 6 months. But the standard of care is to keep the patient in a provisional, a prototype, if you will, for a period of at least 3 months.
According to my experience, no question about it. Don't be waiting on it. The earlier you start some treatment, clearly the better.
Carotid carotid disease is a very important risk factor for stroke, and carotid disease develops because of plaque formation in the carotid arteries, especially near the carotid bulbs and involving the internal carotid arteries. Those are the arteries that feed the brain. So people who smoke, who have high blood pressure, have diabetes, these are all risk factors for carotid disease, and many times these go silent. So we try to evaluate our patients with carotid ultrasound, which evaluates the blood flow and the anatomy of the carotid arteries. If we find significant carotid disease, we either think of surgery or carotid stenting. Carotid stenting is an innovative way of treating a patient without cutting on them, which is very important. And many patients are good candidates for carotid stenting. Carotid stenting is done in usually university settings, especially here at the Texas Heart Institute. We have great interventional cardiologists who do this. Ask your doctor about carotid stenting if you have carotid disease. It's a great alternative to surgery.
If you want to have decent hearing when you're in your 90s, you can exercise your ears. Simply turn on some music and practice singling out a single instrument and listening to it. This exercise can help to hear more details in everyday sounds.
Gosh, I was young, maybe about 6 years old, and was tagging along with my older brother playing golf, and I just so happened to get too close to him when he was teeing off and got hit with a backswing right in the nose. And from then on, that's when the problem started.
Joey came and see me because he can't breathe through his nose. So he has to breathe through his mouth. He doesn't sleep well at night. He snores a lot, and that makes him tired all the time.
You know, you would sleep through the night but wake up and not feel rested. You know, even though you made it through a whole night and got a whole night of sleep, you just wake up and feel like, gosh, I really don't even feel like I slept at all.
When we examined Joey, we noticed that the wall in the middle of his nose, what we call the septum, that separate the left and the right side, was crooked, in his case, was crooked on the right side, you know, causing him problem to breathe through his nose. And we agreed upon a treatment plan that consists of first a surgery to correct his septum, to straighten up his septum, so to improve the nasal airway.
Very simple outpatient. You know, everything was explained to you. Go in the morning. I actually took a little nap right before surgery because it was early in the morning. Woke up and that was it. So it was real simple, real easy.
Joey's quality of life has improved tremendously. He breathes better, he sleeps better, and he enjoys life more.
Well, you know, you just don't realize it, because I've had it for so many years, you just get used to, you're thinking the way you're breathing is normal, and it's not. And then once it's changed the way it is, you know, I'm able to do things without getting winded, you know, because I'm not having to open my mouth to breathe now. I'm able to breathe clear through my nose.
The number one reason that patients come and see me is because they can't breathe through their nose. In most of the case, there's a solution for that. As a Center of Excellence in Nose and Sinus Disease, I'm always in the forefront of medical research to improve my patient outcome. Medicine has advanced so much that there's always a solution to breathe well and live well. Patients don't have to suffer anymore.
What a great show today, but that's going to wrap up this edition of Best Docs Network, the show that's featuring some of the best doctors in the Houston area that are really changing people's lives. Now, if you have a question or a comment or a life-changing story of your own, we would love to hear from you. Send us an email at info@bestdocsnetwork.com. Thank you for watching, and I'll see you next week.